stages of pregnancy are were made. Gestation starts at the moment when the fertilization of the egg occurs. It is considered week 1 pregnancy the time of the last menstruation of women. In total, the pregnancy lasts about 40 weeks, 208 days. Pregnancy is divided into 3 stages, about 12 to 13 weeks each. Typically, these stages are called trimester because each covering about 3 months. First trimester. The first day begins with ovulation and subsequent fertilization of the egg by sperm. A week or so, the fertilized egg is placed in the uterus and develops slowly fetus and placenta. This attaches to the uterine wall and then joins the fetus by the umbilical cord. In these early weeks of pregnancy, the baby grows rapidly. Not only the size of your body and his weight multiply, also develops almost all organs and tissues of your body. The pregnant only feel internal change because there are not many external change. The most characteristic symptoms are fatigue, nausea, vomiting, and dizziness. In second trimester, dizziness, nausea, and vomiting are reduced, but so it increases appetite and begins to have weight gain. It also increases the size of the uterus, which can cause discomfort in the belly of the mother. At this stage, for the fourth or fifth month, you can feel the baby move. In this trimester, the baby are already past the stage of embryo and fetus becomes. Now will continue to grow. Their bodies begin to different into their roles and begin to develop your sense. Later this trimester, he or she starts hear the voice and sounds of the mother. The third trimester, this stage is the most safest because in case of premature birth, there is every chance that the baby will survive. Pregnant bell will be large because the fetus has grown. Also, the baby puts in position for birth. He put with his head down, pointing to the birth canal. It is also the time they finish their lungs mature, essential to adapt after birth to a different environment, where he will breathe on his own. In this third trimester, the mother has already gone through all kinds of emotions and feelings and should begin preparing for the moment of the birth.
Is a complication of pregnancy characterized by high blood pressure, protein in the urine, and a number of other symptoms such as a headache, visual disturbances, and abdominal pain. Fluid retention is also part of the syndrome. Symptoms of preeclampsia usually appear in the third trimester of pregnancy. About 6% of all pregnant women will develop preeclampsia sometimes after completing 20 weeks of gestation. This condition most often occurs in women having their first baby. The causes of the pregnancy syndrome preeclampsia are multifactorial and poorly understood. Are two principal stages. The first stage is reduced placental perfusion, frequently secondary to abdominal implantation and insufficient remodeling of spiral arteries feeding the interbilious space. The second stage is the maternal response to this condition, modulated by maternal constitution and heredity, and characterized by widespread inflammation and endothelial cell dysfunction. Maternal factors including pregnancy obesity and insulin resistance predispose to development of preeclampsia. A key component in the development of preeclampsia is the maternal predisposition to cardiovascular diseases. The diverse effects of pregnancy include a prompt impact upon lipid metabolism, maternal cholesterol levels increase during pregnancy, this is important for the fetus during early pregnancy. The pathological lesions of the residual arterioles in preeclampsia include fibrinoid necrosis of the vessel wall, aggregates of platelets, and accumulation of lipid-laden macrophages. In severe preeclampsia, hypertension and proteinuria increase even more and urine output may decrease. Severe preeclampsia is associated with dysfunction of other organs or slow growth of the fetus. The only definitive cure for preeclampsia is the liver of the baby. A pregnant woman with any of these symptoms should contact her clinic immediately. Vaginal bleeding, continuous headaches during the last 3 months of pregnancy, severe urinating abdominal pain, persistent vomiting, decreased fetal movement after 24 weeks. We used to try to prevent preeclampsia by limiting a pregnant woman's salt intake or by prescribing diet pills to prevent weight gain or diuretic drugs to prevent fluid retention.
Giving birth is considered the happiness moment of the life of the mother. That is the final step of the pregnancy when the baby is born, and I will give you some information about the giving birth. Sometimes of giving birth in the mother, that it could be the natural childbirth, that this is a normal way, that there's no medication and it's only the work of the mom and the baby. Then is the cesarean section. It's a surgical intervention and the baby is common that it was in problems and can born without help. Type of birth is the birth in water that is more relaxed and some mothers prefer that type of birth of the baby, but it's not a conventional and it could be dangerous. And there are some symptoms that the mothers have when they have given birth, and it could be the contractions that are the principal symptoms. Is for more than 5 and 10 minutes, and there is then when the uterus is in the contraction, and for push the baby is outside, is giving outside the baby of the body. Symptoms that are in the giving birth is when the loss of the mucus plug and the rupture of the amniotic sac. There was sometimes prevent the baby go outside and for the body of the mom. Finally, for prepare the birth, the mothers need to go to classes and do some exercise for the exactly moment when they are going to give the birth and born the baby. The giving birth finished when the placenta was expelled for the body of the mother.